I wanted to take the opportunity to speak to you today about whether osteopathic clinics should remain open. But firstly, and importantly, I hope you are keeping as well as you can in these extraordinary times. We find ourselves in completely uncharted waters as the situation with the COVID-19 pandemic continues to evolve. These are difficult times for the profession and there are no easy answers. The situation will continue to evolve daily, and I want to try and provide you with some clarity during this time of great uncertainty. Since the Prime Minister's address to the nation earlier this week, we have received an increasing number of telephone calls and emails asking whether clinics should close. We have published an updated statement which you can read in full on the COVID-19 page of the General Osteopathic Council website. In short, however, the government guidance does not yet prohibit osteopaths from continuing to open and provide care to patients. To reassure you, we are in regular contact with health authorities, the Institute of Osteopathy, and other professional regulators as we continue to discuss this matter. Should the government change their position, we will act quickly to provide you with an update. While the guidance encourages you to continue to use your professional judgment in determining whether it is appropriate to see patients, we would urge you to consider the government advice to stay home and save lives, and to consider speaking to patients by video call or over the telephone if necessary. The Institute of Osteopathy has issued a recommendation to osteopaths that all but emergency and urgent consultations be conducted remotely, over the phone or online. For those who choose to provide cover for emergencies, the guidance as to what constitutes an emergency and how this should be managed is stringent and must be adhered to. We know that many of you have chosen to close your clinics, at least for face-to-face appointments, until the situation improves. For those of you that are continuing to keep your clinics open, you need to consider the benefits of treatment to your patients against the risks posed both to your patients, yourself, and the wider public. And this needs to be in the context of the transmission of COVID-19. I would just say again, implement the guidance both from the government and our own infection control guidance. Consider the benefits of treatment against the very real and significant risks associated with transmitting and catching this highly infectious disease. The fundamental role of the General Osteopathic Council is public protection and maintaining public confidence in the profession of osteopathy. We will continue to work with you to that end. These uncertain times present challenges and anxieties for us all, but we need to remember this: we are part of a community with strong values who come together to protect the public and patients. Thank you.